So hi everyone, my name is Lauren. I'm a first year medical student at Stanford and I'm a part of the ADMD Student Resident Committee, and I'm here today with Camille and Dr. Perlman.
Hi everyone, my name is Camille. I'm a third year dental student at Harvard. I serve as the Associate Chair for the Student Resident Committee with AADMD, and it is our pleasure to introduce Dr. Steve Perlman.
Thank you. And hi, I'm Steve Perlman, and I'm in Boston. And it's very heartwarming for me and a privilege to be here because little did I know that the vision I created 27 years ago would lead to where we are today. So thank you for having me.
Well, we're very happy to have you. Now to get a little bit on your journey, can you talk to us about your experiences with Special Olympics and the Shriver family, and about how you were able to integrate healthy athletes into the Special Olympics mission?
Sure, my pleasure. So I'm a pediatric dentist, but I'm an old school pediatric dentist. So when I trained, we took care of patients with special needs from birth until death. There was never any transitioning for us. About 15 years ago, pediatric dentistry became an age-defined specialty. And so the newly trained pediatric dentists don't want to do adults, and they haven't had the training in adults. And it's really been devastating to the continuity and the way that we, in the dental profession, that we treat patients with special needs. So my journey and career has been two phases. So the first, it was like normal pediatric dentist, academic route at BU, at Boston University, and limiting my practice to dentistry for children, adolescents, and people with disabilities of all ages. I was fortunate enough to have my partner in my practice was a dual trained. He was a fully trained pediatric dentist and a fully trained orthodontist. So we had an inclusive practice with those two specialties. And we had a very large practice, and not because we were so great, or it was just that because of the nature of the field and dentists not taking Medicaid patients, and a lot of adults with disabilities had Medicaid, that I saw my practice grow. And at the end, I had over 1,200 patients with disabilities in my practice. But the first part of my career was being active in special care dentistry and the Academy of Pediatric Dentistry. And then 27 years ago, I got a call from Eunice Kennedy Shriver, who's the founder of Special Olympics and the world's champion for the rights for people with intellectual disabilities. And Mrs. Shriver called me to tell me that her sister, Rosemary Kennedy, the famous sister with an intellectual disability of President Kennedy, had all these dental problems, and would I be willing to treat her? So the history of this was Rosemary Kennedy, as most of you know or can read about, had a lobotomy done. The family was Joe Kennedy was grooming his boys to be president of the United States. And at that time, if you had an intellectual disability, it was like an embarrassment. And some physicians at Mass General Hospital had convinced him that by doing a lobotomy on Rosemary, that it would cure her intellectual disability. And today, probably she could have been treated by psychotropic drugs or something, but these a neurosurgeon what was the other, I forgot the other guy, but they decided to do this lobotomy. And after the procedure, it was devastating results. And Rosemary was banished to St. Coletta's in Wisconsin for the remaining years of her life. So Rosemary her dental care had been addressed by a team of general practice dentists. So this wasn't a single dentist, this was a team approach. And they decided to edentulate her at 73 years of age. And so they needed permission of the legal guardian, Senator Kennedy and Eunice Kennedy Shriver, to do the edentulation. And when Mrs. Shriver heard about this, she said, "No way, nobody's going to remove all of my sister's teeth." And they put on a search in the country to find somebody to treat her. And interesting, they picked, for a 73-year-old woman, they picked a pediatric dentist 2,500 miles away. So what a sad case of access to care, ability to receive quality care for people with intellectual disabilities. And so my first call was to the primary care physician that was seen by Rosemary, and I had to clear her because I had a one-shot window to do her oral rehabilitation. I wanted to make sure that she was healthy enough to make the trip and healthy enough to withstand 5 hours of general anesthesia. So my first call was to the primary care physician, like I do with all my patients. And I said, was she capable of handling the general anesthesia and the time and the travel and everything? And more important, as long as I was going to do the procedure, were there any other health things that needed to be done for her? And the primary care said, yes, we've never been able to get a good gynecology exam. And she had these lesions on the face that the family didn't like. So can you arrange to have a plastic surgeon while you did the oral rehab? And so I said, of course. They flew Rosemary to Boston. I admitted her to a local hospital. And in a 5-hour window, I restored every tooth in her mouth, complete reconstruction. And it wasn't that difficult. And we did the gynecology and we did the plastic surgery. And when I called Mrs. Shriver to tell her that her sister was fine and that we were sending her back home the next day, she said to me, my family wants to meet you and thank you for everything you did for us. But more important, if my sister had these problems, what about the poor people with intellectual disabilities all over the world? So 3 weeks later, I found myself in Washington, D.C. with Eunice Kennedy Shriver, her husband, Sergeant Shriver, who was chairman of the board of Special Olympics, and an amazing American hero who founded Head Start, Office of Economic Opportunity, and of course, the Peace Corps. And the third person in the room was Dr. Robert Cook, who's the founder of developmental medicine in the country. He was the first pediatrician that he founded the field of developmental medicine. And at that time, he was head of pediatrics at Johns Hopkins Medical School. And so Mrs. Shriver said to me, okay, you have 2 hours to teach me everything about dental care for people with intellectual disabilities. And I said, I don't want to talk about dental care. I want to talk about health care for people with intellectual disabilities. And she said, what do you mean health care? They get as good or better health care than the neurotypical population. I said, Mrs. Shriver, you couldn't be more wrong. They're the most underserved and medically underserved population there is. So she said to me, you know, I am the champion for people with intellectual disabilities. And I thought in order for them to succeed in life, it would be education. So I fought for education and because everybody needs the highest education they can get. Second of all, when they grow up, what are they going to do? Everyone needs to feel productive. So I fought for job opportunity. And the third thing is with the closure of all the institutions in the country, where are they going to live? I care about safe housing. I never thought about their health. I thought that it was as good or better than the neurotypical population. And Dr. Cook said to me and said to Mrs. Shriver, he said, you know, Eunice, Steve is right. It is a terrible problem. He said he actually had two children with Crudichad syndrome who could not have survived if they weren't in the institutions that were taking care of them. And so when Mrs. Shriver heard this and Sergeant Shriver, they both looked at me and they said, well, we want you to deliver health care for people all over the world for us. And I said, you know, I have a private practice. I teach. I have a young family. There's no way I can do anything like that. But somebody had told me that if you want anything from Mrs. Shriver, ask her if you can use Special Olympics as a bully pulpit or the soapbox for this problem. And so for the first time ever, Special Olympics for the first 25 years was sports, fitness, and self-esteem. For the first time, we were going to embark on health. And I started it with a pilot at Boston University, where on one weekend we screened 750 athletes and accessed them to the healthcare system. And then she brought me back to Washington and said, I care about Native Americans in Arizona, and Mexican Americans in Texas, African Americans in Detroit, Chicago. And so I envisioned the program as I knew that I couldn't change the mindset of 40 and 50-year-old providers, but I thought that I could change the mindset of young students. So I envisioned it as a school program. And so then we branched off from dentistry into vision and medicine and hearing and the other disciplines of Special Olympics. So That's how, really, that's the story about how health came into the Special Olympic movement. And now we have I'm proud to say that we have the largest public health program in the world for people with intellectual disabilities. So now how does AADMD fit into this, right? We only had eight disciplines in Special Olympics, or 7 disciplines at that time. I knew that I couldn't deliver everything that I needed to deliver with just 7 disciplines. Medicine has 200 disciplines. And so, and not only that, but how was I going to take this movement to the next step? So first of all, we had to show that the need for healthcare was there, that these health disparities did exist. And so with Tim Shriver, we went to Yale University and in 1999, and we hired them to do a report on health disparities for people with intellectual disabilities, and that term mental retardation in the old days. So it came out with the famous Yale report. It was 154 pages. That was it. That is what we knew about healthcare for people with intellectual disabilities. So we took that document, and only the Kennedy family could have pulled this off. We took that document and got the first ever Senate hearing on health disparities for people with intellectual disabilities. A historic Senate hearing at the Special Olympic World Winter Games in Anchorage, Alaska, 2001. At that meeting, everybody had to come up and testify. CDC, NIH, maternal and child care, birth defects, everybody was there, and including Surgeon General David Satcher. I had a one-on-one with Surgeon General Satcher, who agreed to have the first ever Surgeon General's conference on health disparities for people with intellectual disabilities. 6 months later, 2001, Washington, D.C. It was like a who's who that was there. The LEND programs, the use of everybody was there. And after that 2-day conference, I started to get calls from physicians all over the country. You know, Steve, I'm a neurologist in New Jersey. I'm an expert in seizures. I want to work with you. I'm an anesthesiologist in Arkansas. I'm an expert in craniofacial deformities. I want to work with you. And gastroenterologists and psychiatrists. And so the seed was planted, and a bunch of us happened to be in Chattanooga, Tennessee, for a meeting of the Southern Association of Institutional Dentists. And we went over to Rick Rader's house, and we decided that we needed an organization of experts in the healthcare for people with intellectual disabilities. And we formed the AADMD that night at Dr. Rick Rader's house. And that's the history. So I've been so fortunate, blessed to be part of the founding of the health program at Special Olympics, as well as the AADMD.
Great, thank you for sharing that very, interesting story. You've had a very long journey with both organizations, we can see. If you were to look at where AADMD started and where it is today, what do you think has happened over the past, decades?
Well, it started out, realizing that there are 200 specialties in medicine, and that we needed the people, we needed the geneticists, we needed the mitochondrial experts, the metabolic people. We realized that, and that's where AADMD, because to fight the battles that we needed to fight for the families, we have 5 million athletes in Special Olympics in 170 countries. The population in the United States of people with disabilities is skyrocketing. Now we got, 1 in 59 with autism, 1 in 39 in Jersey. We have 11 to 17% of kids with ADHD. We have all these disabilities, and parents, and then being in the trenches as a trench warrior myself with the rest of the people in AADMD. The great thing about our group is we don't have a lot of, everybody's like a trench warrior. We don't have a lot of ivory tower physicians that don't have the pulse on what families and caregivers need. And when in private practice, when you hear this, when I faced with the stories of parents and living with this for 40 years in private practice, I knew that we needed a cadre of experts to help when a child is denied an organ transplant, when a patient is denied a surgical procedure, because some insurance company bureaucracy, or just a general lack. I had a very interesting experience in my own practice. I had a 13-year-old girl with Down syndrome who was G-tube fed and legally blind. And when she was born with a cardiac defect, the surgery resulted in one leg being significantly shorter than the other, and and moderately to profound disability. And she grew up with one leg being significantly other. And when she was 12 years old, the head of orthopedics at a major hospital said that she needed an amputation and a prosthetic, and then she will grow straight. And what happened was that they couldn't do it. They said, she's G-tube fed, she's blind, she's got Down syndrome. We can't do this to her. The physician was bullying them into doing this procedure that it had to be done. They went for a second opinion at Hopkins. He agreed with the first physician, and then they came to me and said, and I'm the dentist, and they said, can you help us? And I reached out to my AADMD guys, and we found a surgeon in Florida who specializes in limb lengthening. And the parents went down there for a consultation, and they met a physician who didn't look at a child with Down syndrome with all these multiple problems. He looked at a leg and said, I can fix that. And he did. And so she was spared the amputation. The parents can't even talk to me about the story, because they said that they were this close to having their leg amputated by this top orthopedic surgeon, and they were bullied into it. And this exists. I have a patient in my office who came to me 10 years ago, an adult with a quadruple amputation. So he had his arms from here and no legs. And he was in my waiting room. He came into the office. I said, why are you here? I'm a pediatric dentist. And he said, no dentist will take me in the office. They won't treat me. I said, why? He says, well, it was summertime. I'm wearing shorts. I have prosthetic legs and arms. They just don't want me in the office. So he's my patient for 12 years. And he came to me a few years ago and he said, guess what? I'm going to be the first human being to get bilateral arm transplants. I said, you're 60 years old. He said, yeah, but I'm such a, they love me. And at the Brigham, they did bilateral arm, first human to get bilateral arm transplants. And you know what? If I didn't treat people with disabilities, I'd miss the relationship and the miracle of having patients like that. But this is why we need to. I could tell you story after story about 40 years of practice. You can imagine it. But the reason that I bring these up is that the AADMD, we fought for baby. There was a little girl that was denied a cardiac transplant because she had 11 fingers and tested for some form. She was 6 months old, tested for some form of an intellectual disability. And Loma Linda refused to do the cardiac transplant because she had some form of an intellectual disability at 6 months of age. How can you predict it? So I went to our resources again, and we showed that the child deserved that heart transplant. But unfortunately, the situation dragged on for so long that she passed away. But the good news is that for the family, we got her into a hospital that was willing to do the transplant, and she passed away, but the parents knew that they died, that she passed away, but somebody was willing to do it. It wasn't just she's too retarded or going to be too retarded for us to waste the time of our surgical team. So that's the power of the AADMD and why you can see that it's so. You have a child with I had a child with congenital rickets, and the top specialist in the country is at Barnes in St. Louis. The insurance company wouldn't pay for the child to get a consult from somebody in another state when there was nobody in our state that could do those services. So we have to do that's the beauty of AADMD, because we're not bureaucratic. We're not the American Academy of Pediatrics that would call a meeting and have a meeting and a meeting, and then 3 months later, the person would be dead. So we have a lot of stories that we can tell, and everybody in our, we're just heroes to a lot of people are my heroes.
Well, great. Thank you so much for sharing all of those stories. I guess to wrap up, we probably have a lot of students watching this, medical students, dental students, students in other healthcare careers. What would you say to a student who either is unsure about treating patients with an intellectual disability, or this is already their passion? What's your last message to students?
Well, the last message is if it's everybody's got to do their share. You know, in dentistry, they've been fighting should special care dentistry be another specialty in dentistry, right? There are 300 members in 300 members roughly in the biggest organization before ADMD was founded, special care dentistry. Are 300 dentists, and that includes hygienists, are they going to service 7.5 million people with an intellectual disability and 53 million people? It's specialist envy. No. And in medicine, it's so fragmented because maybe you get some training in pediatrics, right? But in medicine, there's no transition of the hard transition from pediatric neurology to adult neurology, from pediatric cardiology to adult neurology. I mean, my best friend and running partner was a cardiologist, and he didn't want those pediatric cardiology syndrome patients when in his practice. He just didn't know how to handle it. So we have to figure out the way of transitioning for patients with special needs. And the dental profession has to realize that it's everybody's problem, and everybody has to pitch in to do their share. The numbers are staggering now, and they're increasing each year. We have to be the advocates for this population.
Great. Well, thank you so much for sharing and for talking with us, Dr. Perlman. You're always such a wealth of knowledge.
Thank you. Thank you.